family mode.
Hello and welcome to First Things First, our first short webinar to introduce you to a priority setting process and decision tool. We'll show you a toolkit from NACCHO and we'll also share a community example and have time for Q&A. It's a very toolsy short webinar, all in under 20 minutes. My name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague Kate Conkle.
Hello everybody.
And we'll be taking turns answering your questions as well as sending out links via the chat box. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute, and it's a collaboration with the Robert Wood Johnson Foundation. Thanks to their support, we're able to bring you this webinar today. Before we dive in, a quick orientation to the technology we're using today. The GoToWebinar attendee interface is made up of two parts, and on the left you can see the viewer window where you'll see our screen throughout the presentation, and on the right you can see the control panel. Here you'll find handouts for today's session, which includes a PDF of our slides and a PDF of the worksheets the community we're highlighting used to prioritize. You can also interact with us through the control panel by using the question section. So please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today. We'll be sure to leave time for your questions. So why did we decide to focus on prioritization as our first short webinar? From our model, we know there are multiple factors that impact how long and how well we live. And we know that there are big health gaps within our most vulnerable populations. Building a culture of health is a multifaceted, complex, and dynamic challenge in every community. So everything is a priority. However, if we don't have a process for moving from data to focused action, we also know it'll be really difficult to make progress on anything. So priority setting is really important. So our challenge is, how can we set priorities efficiently and effectively in a way that builds on what the data say and honors multiple voices from the community? By the end of our time together, our goal is for you to have some answers to this question. To answer this, we'll be going to the Focus on What's Important guide in the action cycle. You can see from the Take Action cycle as we work through the steps, once you've assessed your needs and resources, it's time to focus on what's important by setting priorities to work on. By setting priorities, you're better able to focus your efforts and find specific strategies to address the most important issues in your community. You'll also want to use a priority setting process when you need to choose which strategies to implement. For now, we'll look at the focus step. That's where we'll find the tool that we're highlighting. Where we'll see Prepare to Prioritize, it's where we'll go to find the NACCHO's First Things First tool. Let's go to the website now, and we're going to take a look at where you would find First Things First. And this will take just a moment as I switch over here to a different screen. And you all should see our website now, and you'll see the Action Center, which is in Roadmaps to Health. And I'm just going to scroll down a little bit here, and I'm going to slide over onto Focus on What's Important. And when I pop onto that step there, we can see what it's all about. This guidance is for these kinds of questions. So if you're wondering, what if everything feels like a priority, or how many priorities are reasonable to choose, and what if members of our team disagree about priorities, how can we narrow our focus? These are the kinds of questions that this guidance in this step will give you. So we're going to click on that, and as I mentioned, we have 8 key activities for this guidance, and we're going to pop into Prepare to Prioritize, where we'll find the guidance for how to get ready to prioritize, and we'll also find First Things First. We'll click on that. You'll see the description. It comes from NACCHO, and it describes 5 prioritization methods. Let's go in and take a look at how they present that. And I'm just going to enlarge my screen a bit so we can all see this a little bit easier. And this is an 18-page document. There's quite a bit of guidance in here, but very user-friendly. They provide you some criteria for choosing a priority, and these are the 5 methods that they highlight in this toolkit: multi-voting, strategy grids, nominal group technique, the Hanlon method, and prioritization matrix. So we're not going to go through this entire toolkit here. We just wanted to show you where you could find it, and then you can find the right method for your particular circumstance. So what we're going to do next is go back to the slides, and we're going to illustrate how to use first things first with a community that actually went through using 2 of the methods. So we're going to show you how a community used multi-voting and the prioritization matrix. And actually one of your handouts is the worksheets that this community used. In May of 2011, Joplin, Missouri was hit by a devastating level 5 tornado which left a 12-mile long, 1-mile wide path of destruction. This event had a major impact on the most vulnerable members of the community. Now fortunately, the whole community pitched in to help people get the shelter, food, water, and medical attention that they needed. But several years later, they realized that they really needed to take a closer look at food insecurity issues. These were continuing. The Joplin Food Access Network, JFAN, was formed, made up of healthcare, nonprofits, public health, schools, local government officials, and business stakeholders. JFAN commissioned a comprehensive needs assessment of the food environment, which included resident surveys and door-to-door interviews to make sure community voices were heard, as well as an in-depth analysis of prices and healthy food availability from corner stores to restaurants to schools. The result was the Joplin Area Food Assessment, which was shared at a public forum sponsored by JFAN. I'm going to give you an overview of the process, and then we'll go into more depth about each of these steps. So at the forum, after listening to and discussing the food assessment report, the group broke into small groups. And the question of the day was, what are the top priority food access issues in Joplin? And they went through several steps to narrow down a large list of ideas to a smaller list that then the whole group could then vote on according to criteria that they felt was important, that they had pre-selected. At the end, they had a strong list of 5 priorities in rank order. So let's walk through that process in a bit more detail. So again, using the focus question, based on what we learned from the JFAN assessment, what are the top food access issues in Joplin? First, in small groups, individuals silently brainstormed on sticky notes, 1 idea per sticky note. Then, without talking, they moved these sticky notes together according to their similarity to one another. And as a group, they then named each grouping with header notes. This is called the affinity diagram process. It's a good way to organize long lists of ideas. Here's an example of one of the small groups brainstorming of priority issues. This is their one part of their affinity diagram. Once they brainstormed ideas on sticky notes, they used this affinity process to organize the notes, and then they drew boxes around the groups of ideas that were alike and named them. The remaining ideas not in the boxes didn't have enough other ideas that were similar, so they just stand alone. They then determined their top 2 priority issues to bring back to the larger group. So each of these small groups are brainstorming, and then each of the small groups are then highlighting the 2 priority issues to bring back to the larger group. And the way they did that was each individual in each small group had 2 sticky dots to cast their votes. They could distribute their sticky dots however they liked on the header cards. This then, when all the small groups shared back each of their 2 top priority ideas, this gave the larger group a list of 14 ideas. The large group then multi-voted to narrow the list of 14 down to a list of 7. And each individual was given 5 sticky dots to get to place on the 14 items. This is where the multi-voting came in. Is when you get 1/3 the total number of items to vote on. So in this case, they had 14 total items, and they were given 5, each individual was given 5 sticky dots. And the result was the 7 bolded items. So that's multi-voting. Then, back in the small groups on individual worksheets, individuals rank ordered each of the 7 issues 1 criteria at a time. 7 was the most important or strongest correlation to the criteria, and 1 was the least important or weakest correlation. So when you do rank order, you start with what you think is the most important. In this case, it was a 7 because there are 7 issues. Then you think about what is least important and give that a 1. Then you move to second most important and give it a 6, then back to the next least important and give it a 2, and you keep moving back and forth until you've ranked all the items. It's important to focus on 1 criteria at a time because your rankings will change according to the criteria, which is actually the point of a priority matrix. So each individual added up their own scores for each issue. The groups then put all their scores together and averaged them to get team scores. This process is called a priority matrix, and it's one of your handouts. The first worksheet is the individual scoring guide. The second is the team scoring guide. The small group scores narrowed the list down, that big list, from 7 to 5 with a really rich understanding of why these 5 needed their focus because everyone had vetted them so thoroughly in rank ordering and discussions. And they then had a large group discussion about which of the 5 were already being worked on and could benefit from more attention and which were out of their control as a group. But others in their community had influence over and perhaps they could collaborate with them. Their next step was a root cause analysis, but that's for another short webinar. So now let's see if we can answer some of your questions. Kate, do we have any questions?
We do, and first I just want to say thanks for the great short overview of this tool and process to help people prioritize. We do have a question about the criteria in the priority matrix. So how do you set those criteria? Are they sort of pre-established or does the community come up with those on their own?
You'll find in First Things First, they actually give you a lot of suggestions for criteria. So what we'd recommend is that you do some pre-planning and talk as a community group about what are the most important criteria to have in your matrix, because that really will influence very much what it is you end up focusing on for your priorities. In this case, their overarching question in Joplin was, how is whatever we do going to affect the most vulnerable among us? And they got that by thinking through the JFAN needs assessment of the food insecurities. They also felt really strongly that whatever they were going to focus on really had to have strong decision maker support because they wanted to focus on policy systems and environmental change. And being aware of the costs of implementing anything or working on any issue, that was one of their key criteria.
All right, sounds good. So a little bit of suggestion, but then also the community thinking about what's most important to them. So do you have any thoughts on, this is a question coming in about, this looks like kind of a big day-long process. Is there a way to get community input into priorities if people don't have time to come to a whole day-long meeting?
Yeah, that's such a great question. I think, there's so many different ways, so many creative ways, and I'll bet some of the folks on this webinar have some ideas too, so please feel free to chat those out to us. I know for Joplin, for example, they had people in the room that were out working in the community and were very grassroots involved. They were like community organizer type folks. I know another group in Petersburg, for example, they have Petersburg, Virginia, they have community health ambassadors. It's a similar kind of approach, and so those people meet with people individually, have meetings in the evening, for example, in the communities at times when people are perhaps a little more available. Also in churches, faith organizations are a great gathering spot, as are schools, and so as many different ways as you can think of where people would be and who is working with people on the ground floor, there are that many ways to get community voice authentically into the room and represent them. I know, for example, in one of my coaching teams, they felt so strongly, and I just love this approach. They said at every one of our coaching meetings, let's make sure that one of us has always designated the community voice, that no matter what we talk about and what decision we make just ongoing, we will always stop and check how would the community react to that, a community resident, and how would we know?
Okay, great, thanks. So I think we have time for one more question. So one of the criteria was about how the priority or how the issue impacted vulnerable populations. So is there a way to drill down beyond the county level data so that you can understand how an issue might impact some of those sub-county level or higher risk populations?
Well, I know for the Joplin group, they actually went beyond our food environment index, which is one of our measures in our model, and they actually dug into the food equity atlas, I think it was called. We can chat out that specific link afterwards, whoever has that question. Um, the they basically, there's a lot of mapping capability out there. There's community commons where you can actually go in by zip code, and you can put in what specific criteria you're looking for. So that is another way to look at that. Is there something else you want to add?
Yeah, I would just remind people that the tool that we have, the using the rankings data, does have some links to sites by state that allow you to drill down for some specific issues to sub-county demographic data and look at your data that way. And also in Assess Needs and Resources, we have the collecting primary data. So sometimes, that's a way to go, is to get some more qualitative information and add some more context to the issues to better understand. And sometimes that means you're moving back and forth between these different steps in terms of assess, prioritize, choose. You're sort of flowing back and forth and doing different parts of these process again to better understand and continue to sort of narrow and focus. So I think that's all the time we have for questions. So let's wrap up, and thanks for joining our first short webinar, everyone.
Great, thanks, Kate. So we just encourage you to check out our upcoming and archived webinars on our website. Of course, this particular short webinar will be archived as well. And to learn more, sign up for our e-newsletter and make sure that you register for these webinars. We'd love to see you again. And we invite you to consider, as we often do as you leave this webinar, who else do you need to share this information with, and what's one idea for action that you're taking from this webinar. This is our first foray into doing a short webinar too, so we'd love to have your feedback. What do you think of these? Do you like these shorter versions? Is it helpful? These are very concrete, very practical, and so if you could give us some feedback on that, we'd love to hear from you. And just want to mention, as always, this program is the result of the contributions of many, many partners, including those listed here. So thank you for joining us, and we look forward to seeing you on future webinars.